everyone. I would like to welcome you again from the University of Debrecen. We have a special guest today, Professor Norbert Németh, who is the Vice Dean of the Faculty of Medicine and the Head of the Department of Operative Techniques and Surgery Research. Professor, welcome.
Thank you very much. Greet you all.
Thank you, Professor, for joining our virtual Information Day, where we would like to introduce the Center of Medical Simulation to a prospective student. May I kindly ask you to introduce the center for our students?
Thank you very much for the opportunity for talking about our center, and I really greet all of you who are interested in our education. The Center for Medical Simulation is an integrated part of the Department of Operative Techniques and Surgical Research. This department had been established about 70 years ago in 1951, dedicated for surgical, we would say nowadays, skill training and research, obviously. And in the later decades, more disciplines had the request and the demand to provide kind of practical background and equipment to train students for basic medical competencies. And this was the reason for establishing the Center of Medical Simulation almost 10 years ago. Now these two units are together, serving the same purpose. So the center itself, as I said, provides the facility for the practical education, and we have a wide range of equipments from the really basic modules, really basic models, up to the high fidelity simulators to have the opportunity to acquire, practice and develop skills for basic medical interventions, learning life-saving methods, including basic life support, advanced life support, but nursing and other manual skills as well, together with traditional modern equipmental methods.
Mm-hmm. Professor, how does the center take part in the medical training at the university?
For the students who wish to be medical doctors, it is a great decision and a beautiful goal as well. But there are several requirements for the future medical doctors. So the significant amount of theoretical knowledge, up-to-date expertise, problem-solving skills, necessary communication skills, several manual technical skills, empathy and right attitude, all should be fulfilled. And many of these skills can be practiced or can be acquired by well-designed consecutive training programs. And here we have, I guess, an important role. As Alan Whipple, who was a famous American professor of surgery and pioneer in pancreatic cancer surgery, said that actual operative skill cannot be gained by observation any more than skill in playing the violin can be had by hearing or seeing the virtuoso performing on that instrument. So it is obvious for the medical education as well. We need facility to start learning these skills without risk, because when the students will work at the bedside in the clinical wards, the patient safety is highly important, but somehow he or she should gain the necessary competencies. So by this multiplicity of expectations, the availability of the practical training units, opportunities, ethics and laws, everything count. We have to provide a kind of educational program which is tension-free but effective. And here the Center for Medical Simulation has an important role, I guess.
Thank you. And talking about the facilities of the center, would you be so kind as to give us more information about the facilities? I know that you have a presentation for us with some interesting photos and videos.
Okay, so I have some photo slides about the department and the center. So we have 3 buildings. One of them is the Center for Medical Simulation. The other two buildings serve the surgical training and the surgical research. In the classical department part, which is dedicated to surgical training, we have several facilities to train students for basic surgical techniques. It is important for all the medical students, but we have obviously several postgraduate courses, including residency training programs and special postgraduate programs and workshops. That includes laparoscopic interventions, for example. We start with simple laparoscopic simulators, then we have a little bit of higher level with team work, and the higher level of the educational program includes real laparoscopic instruments on anesthetized pigs, because who wants to be surgeon really have to have such an experience as well. But we consider microsurgical training as an important tool to improve and develop fine motor skills for different interventions, especially in the minimal invasive microsurgical methods. It is also open for medical students. We have practical rooms for that, but later on, when the one decides to be expert in the field of operative medicine, we have an advanced level of microsurgical unit where he or she can gain a higher level of experiences in microsurgery. We have a lot of demonstration tools like 3D anatomy tables, and we also provide special interventional like high fidelity simulators, not only for surgery, but for other disciplines as well, such as, for example, vascular catheterization simulator. Here I have a little video about that. It is a simple tool, but very precise and very high technology. Just a couple of pictures and recordings about the practice held by cardiologists in the last semester. Here you can see its high fidelity. So without causing problems in real patients, here the tutor can stepwisely demonstrate the necessary steps which are available for the students as well to try it and to understand better. But we also have special simulators for arthroscopy interventions and endoscopy simulators. Orthopedic trauma surgeons often organize workshops here in our department, such as the gastrointestinal tract endoscopy basic interventions are also available by these high fidelity simulators. We have an eye surgery simulator as well. It is set at the Department of Ophthalmology, because they are the one who directly can use it in their postgraduate training programs. But this device also belongs to our network. And I also mentioned that besides these special fields of training programs, all the medical students must learn how to save life, how to stop bleeding, how to establish upper airways, and how to make correct resuscitations. So for that purpose, we have plenty of mannequins and plenty of models for basic life support training, advanced life support training, trauma care, as you can see some examples on the slides. But we also have high fidelity patient simulators, adult simulator, and baby or children simulators to provide the opportunity for a complex scenario. As you can see on the picture, it is not just a task training, it is a complete task with examinations and with interventions as well, since these simulators can show various symptoms and various clinical scenarios that can be managed and controlled by a technician via Wi-Fi connection with the simulator. We have cameras, we can analyze the movements, analyze the communication later on, and obviously we connected real medical equipment for these simulators, including ventilation machines, patient monitors, and so on and so on. We have ultrasound simulator and ultrasound devices as well, with many modules for general abdominal interventions, module for urologists, module for gynecologists, and also module for emergency care. And after this simulator, the students may use real ultrasound devices. We have special models for practicing ultrasound guided interventions as well. So these are complex devices, but we have very basic task trainers, phantom models as well for practicing simple injection, blood sampling techniques, how to perform percutaneous cannulation of vessels, how to make central venous cannulation, and, for example, catheterization of the urinary bladder or rectal digital investigations, examinations. So it is better to do it on models before do it in the clinical practice. Various models for ophthalmological, ENT investigations, intubation models with normal and with difficult situations also provide a great opportunity for basic practice. For gynecologists, we have plenty of demonstration tools, making opportunity to practice basic examinations and the delivery. Plus, we have certain neonatological modules, which has also great importance for the basic general practice. So very briefly, we can say that if we have a look on this slide showing the organogram of the Faculty of Medicine with numerous departments, I showed the departments which are connection with the simulation center. So at the moment, at least these departments hold practices in our facilities, and we have a really strong connection with those departments. So this is what I wanted to show you. I hope that it was clear, and I really hope that the ones who will come to Debrecen will enjoy the opportunities in our Center for Medical Simulation and the department.
Professor, thank you very much for your presentation. I think I can tell in the name of all of us that we are pretty amazed about the equipment and facilities that the university has and that the medical students can use in their trainings. Do you maybe have some future plans, future projects in mind that you can share with our audience?
Yes, as the various skills have to be acquired and continuously developed, it is also true for our center. So obviously we have plans. It is a dynamic process, as I would say so. So we wish to enforce further the relation with the departments. We wish to invite more departments to enjoy the practical facilities in the center. Obviously, for that purpose, we need to develop the equipments as well, because the market is very wide and new opportunities are also came up even every month. And the plans also includes to develop the variety of the modules in those high fidelity simulators. And that is another good opportunity that should be followed. And it is the integration of the virtual reality or augmented virtual reality with these simulators. It's another very exciting field of the skill training programs. But we need to continuously train our technicians. It is a specialization of educational methods. So we have good cooperation with other simulation centers at national and even at international levels. And I consider very important the training, the trainers project, because it is not an easy thing to demonstrate and use these kind of models and simulators for an effective practice. So the tutor should come, the tutor should learn about these methods, have to use those simulators for the effective demonstration, for the really effective practice. So it is another continuously planned issue. And we wish to involve the students more actively, not only just for taking part in the practices, but to help practices. Because, as I said, it is a very exciting, good technology. It might be very interesting for students. Even they can be included into development of various scenarios on these modules. Plus, many of the devices are capable to assess skill with objective parameters. So it also can be a good idea for students to join us and make a kind of research work with collecting and analyzing those objective data. So these are not only just simple plans, these are continuous issues, as I said, and we already started to develop these aspects.
Thank you very much, Professor. These are very exciting plans, and we hope that you will be able to implement them as soon as possible. And thank you for introducing us your technology, your models and infrastructures. These are really on a wide range, and they are really modern technologies, I could say. So thank you very much again for your introduction.
Thank you very much.
Thank you.
Thank you very much.